Carol Ofori, East Coast Radio.
We're obviously talking about what everybody's talking about, which is the Hantavirus that is happening. And right now, I am chatting to the national spokesperson for health. We've got Mr. Foster Mohale. Hi, sir. How are you?
Thank you very much, and thanks for this opportunity, and greetings to your listeners.
Thank you so much. So it's a big talking point across South Africa. If it's not the social media streets, it's the normal streets. Hantavirus. What exactly is going on? Can you paint a picture for us?
I can confirm that as the country, we were requested to assist with medical evacuation of one of the passengers who were on the journey in a cruise ship traveling from Argentina to Canary Islands through several stops at different islands, which include St. Helena, Cape Verde, and so forth. So the patient experienced serious health complications. The first patient, unfortunately, he passed on before he could be assisted. The second patient, who was the wife to the first patient who passed on, requested to be taken out of the ship and a vessel back home. She's from Netherlands. They managed to facilitate and get a flight from St. Helena Islands to South Africa to connect a flight to Netherlands because the nearest international airport was South Africa. So as she was getting ready to connect a flight, she collapsed at the airport. She was taken to the nearby hospital around Captain Park where they were giving her medical attention. Unfortunately, she passed on. Then they quickly ran the test just to establish what could be the cause of death. Then the laboratory test results came back positive of Hantavirus. So third patient was also evacuated medically to South Africa as Sandton for medical attention. Then they ran the test while he's still hospitalized. The test, they came back positive and is still in isolation. His condition remains critical but stable.
Right. How contagious is this virus? And can you explain to us what are the symptoms? How do you get it?
This virus is what we call zoonotic virus. Zoonotic virus is a virus which mainly affects animals. But if the animals, they can bite a human being, then the human being can be affected. Just like your rabies, this zoonotic virus is mostly affecting a type of rodents or rats mostly found in South America and some few parts of Europe and Asia. So like we have got a number of rats in the country, especially in the informal settlements. You will find a very huge rats, same size as a cat. But the good thing is that they are not poisonous rats, just like the ones that are transmitting this antivirus. So if you get bitten by this kind of rats, or you smell their feces, or their saliva, or you smell the urine, then that can affect your lungs and you can finally get infected by this antivirus. So this is how it contagious. So then from the rat to human being, the human being can infect the next human being only if they are in close contact. For example, that's how the first two patients who died, because they were in close contact, obviously they are husband and wife. Yeah. So obviously, it was bound that if one is sick, it's going to affect the second one.
And now that this patient is in this hospital, a big question people are asking is, obviously, they came via a boat. The boats would dock either in Cape Town or in Durban or one of our other ports. Why was it that this person was taken as far as Johannesburg for treatment?
This ship did not even come to Joburg. The boat was at the St. Helena Island, which is very far from South Africa. Okay. But because they looked around the nearest countries with capacity, with the infrastructure, with all the amenities, they say the nearest strong country in terms of a health system is South Africa. So let's request South African government to help us to medically evacuate this patient. So that facilitation, it was done through the health insurance provider. Most tourists, when you go to other countries, especially in Europe, the developed countries, when you apply for your visa, you must also show a proof of health insurance that if you happen to fall sick in that particular country, who is going to take care of your health? So the health insurers from the countries where they come from, they facilitated that medical evacuation, obviously in consultation with the captain of the ship. So that's how patient landed from St. Helena to South Africa. The good thing is that we in South Africa, we do have the flights commercial flights that travel between OR Tambo to St. Helena Airport.
I'm hearing you saying that you took a commercial flight with other passengers on this flight.
Yes,
to
it's true,
Johannesburg.
yes.
Now,
100%.
are those passengers not vulnerable because she was obviously infected? She tested positive?
What we do after somebody has tested positive for any deadly virus, we conduct what we call contact tracing. All the people who were on duty, we reach out to the Airlink. So Airlink, one of the passengers who tested positive on this day at this time, boarded the flight from St. Helena Islands. So we need to reach out to all passengers who were in that flight at that time to tell them that they must go to the nearest clinics or hospital for screening, because one of them tested positive for this deadly virus. And we received cooperation from Airlink. I've been on the call with Airlink since yesterday, even just now before we took this call. I was with the Airlink. They've given us the contact details of each and every passenger and every crew member, including the pilots. The symptoms of hantavirus are similar to the symptoms of flu. And in South Africa, at the current moment, we are in a flu season.
Yes.
People are already experiencing flu, the headache, the fever, the body pains, they're struggling to breathe. So only two said they experienced similar symptoms, but we did not want to take it lightly to say maybe they got flu. Say, no, we are going to take you for testing at the NICD. We are in the process of doing that. But we say those who did not experience any signs and symptoms, please try to stay far from the general public for at least 7 days just to see if you don't develop symptoms.
This story seems very similar to 2020, does it not?
No, it's not, because by that time we knew that there's an outbreak of COVID. With this one, we knew that people are sick, but we didn't know what they are sick from.
I got you. So what are your plans now to mitigate any further contact, any further infection, and also bearing in mind this number of people on this flight that were in contact with this patient who passed?
Remember, I said as part of contact tracing, we've reached out to all those passengers. We alerted them that they happened to travel with someone who tested positive, but by that time, the patient did not experience the symptoms. So what we do is say for them to exercise precautionary measures. Let them, in the next 7 days, those who don't exhibit symptoms, limit their movement to public spaces. If it's work, please just ask for a leave from work. If it's church, just ask for 7 days leave from church. They will understand, because you are also trying to protect them.
Right. And Mr. Mohale, do we have capacity to deal with this hantavirus?
Learning from lessons, we strengthen our health system. So that's why after we had this, we didn't wait. We started communicating. Of course, some people were panicking, but we communicated, because communication is very important, especially when we respond to the outbreak of a disease, so that people must know that there's an outbreak of the disease. People must know how to protect them from becoming the victims of this disease, but also providing blow-by-blow update. As we speak, I'm preparing the next media statement to provide the update in terms of where we are now in terms of the situation in the country, and what have we done, and what are we going to do with those.
100%. And my final question is there a cure, and is there a chance of survival once contracting this virus?
Yeah, look, normally, because there's no specific treatment for this virus. Obviously, you can imagine South Africa, for us to spend a treatment for the disease, which we hardly experience in South Africa, it may be a fruitless expenditure. People will say, no, why do you buy $1 million vaccine or treatment for the disease which is not commonly found in South Africa? You get my point? So, but what we do is that in case where we can't have a treatment in South Africa, we work with the World Health Organization. They know that, for example, as I told you, that this virus is mostly commonly found around South America, countries like Argentina, Chile, Paraguay. They will have, because the one that they experience the outbreak of this disease from time to time, they will have some form of treatment for this. So in case where we experience 1 or 2 cases in South Africa, we will go to those countries and say, please share with us the same treatment that we use to treat this disease. But normally we facilitate this through the World Health Organization. They're able to go and buy it for us. These are some of the lessons that we learned from the response to COVID-19, is that once there's something, even if we suspect, we communicate so that people must be aware.
Yes. Now, my last question to you. You've got the platform. Speak to KZN. We are KZN's #1 hit music station. What do you say to people as your parting shot on Hantavirus and South Africa now dealing with its first case?
Please try to check the signs and symptoms of hantavirus, which include fever, headache, diarrhea, vomiting or nausea. If you experience any of those symptoms, don't waste time. Just go to the nearest clinic or hospital for screening and testing. You will be able to help us to prevent further spread of this deadly disease. East Coast Radio, please help us to dispel any myth and any misinformation around hantavirus.
We appreciate that. The National Department of Health spokesperson, Mr. Foster Mohale, we appreciate it. Thank you so much.
Carol Ofori, weekdays 9 to 12 p.m. East Coast Radio.